Welcome back. I'm here with Dr. Taft Micks from Manitoba. Dr. Micks, thank you very much for joining me today.
Thank you for having me.
So you spent some time on the Rock?
Yeah, I did my family medicine training in Newfoundland. I spent 2 years in Grand Fall, Windsor, Newfoundland. Many people, across Canada haven't been to Newfoundland. Absolutely beautiful province, and I was lucky to spend 2 years of my life there.
Good. And then you came to Western University? What's your
Yeah, I
connection
did.
with Western?
My training at Western, I actually done my undergraduate there, but I did my emergency medicine training here in Manitoba. Decided to stay in this incredible province as well. And Barb and I and Alicia had connected while they were both associated with Western University.
Right. And then how did you connect with them in terms of a group? Because I understand you actually flew over on the first trip to Tanzania and you were the
Yeah, I
lead
did.
educator.
Actually, I just got the call from Barb just one day out of the blue. I was here, just finished my training. She had finished her training, and the point of care ultrasound community in Canada is so small. There's a pretty small group of really close instructors, and she had known that I was kind of keen to travel. I just finished my training just like her, and I'd probably be on board. And absolutely, I was very happy to be part of it.
So what was your experience like? We met Dr. Francis just recently. What was
Yeah.
your in Tanzania? Tell us about your experience.
It was an absolutely incredible experience, one of the best experiences of my life. We had done 2 weeks at Dr. Sakita's hospital, a week at another hospital. The learners there, the doctors there, amazing people as well, doing the best they can with the resources that they have. Really, really intelligent people, very welcoming. And then we had spent 1 week kind of traveling around. And while I was in the area, I used this big mountain there, Mount Kilimanjaro, and decided to climb it at the end. And that was an incredible experience as well.
Yeah, why not climb it while you're there?
Yeah, why not? Never know when you're going to be in the area again.
So what's Tanzania like in relation to Manitoba for healthcare?
Well, we're both kind of, where I work, resource limited in certain ways. So in the hospital I work at, we don't have necessarily access to neurosurgery or vascular surgery. And so we're kind of limited in that way. When we then look at their resources in Tanzania, even more limited in terms of maybe not having access immediately to certain scans, and also having to pay for those scans if you require a CT scan. So we're extremely lucky in Canada to not have to pay for those things, but it also points to why we felt point of care ultrasound in that environment was so crucial, because it can be done extremely inexpensive right at the bedside by the doctor, and that could really change your management. You can find if somebody needs something surgical, you can find the source of their illness and maybe why they have a fever. And that's why we did the training there, and it was extremely beneficial.
Okay, so what is point of care ultrasound? Is it on a
So
smartphone?
point of care ultrasound that's a good question you ask. It's an ultrasound machine that can be done at the bedside in real time by the actual doctor. Classically in Canada and a lot of the world, when we see a patient, we then send them off to get their ultrasound done in another part of the hospital. And we have certain questions, but nowadays we can answer those even just with our cell phone. And so you mentioned, is it on my cell phone? Yeah, it actually is. I have this device here called a Butterfly IQ, and I can do ultrasound right here. So if you're ever in a resource limited setting, a remote setting, hours away from a hospital, you can just use your cell phone to look for things.
Yeah, I can only imagine on the side of a road in a collision, you can actually make some type of determination within a couple of minutes.
You got it. Actually,
Right.
STARS here in Manitoba now, our air transport team is actually using point of care ultrasound to make these decisions and give the hospital a heads up before they get there of what exactly they're expecting.
Right. Alicia, your first trip meeting Dr. Micks, how did that play out?
Yeah, so I think the collaboration with everyone who's become part of EM Global has been really smooth. Everyone who's come in to this group shares values about how we collaborate internationally with wisdom and in a way that is humble and learning from one another, and not coming in to kind of have a formula of how we think things should be done. And so everyone who is part of our team has those values, and so it's been really wonderful. Our trip in Tanzania with my family and with Taft, and with the local physicians that were helping also to train, was a wonderful collaboration. And we were so grateful because when Barb recruited Taft, she did not know that she was ill. And she recruited a number of people. And in the end, you know, had these ultrasound machines on my back, and I'm checking into Toronto Pearson Airport, and I get this call that Barb is ill and has this mass. And if Taft hadn't really been there, it would have been very difficult for us to get our first trip off the ground at all. So I kind of feel like Barb just had this wisdom about everything, about so many things. But that was one of them. To bring in so many people was so helpful, and that nucleus of a team has just expanded from here, and we all get along really, really well. So it's been a phenomenal journey.
Yeah. Dr. Micks, thank you so much for joining me from Manitoba today, and thank you for all the help you're doing. Thank you so much.